Hi, I'm Dr. Raja Julius. If you've been told you have Hashimoto's thyroiditis, or if your scan showed a thyroid nodule, it's completely understandable to feel unsure or concerned. These findings often sound more alarming than they really are. What matters most is understanding what they mean, how we evaluate them, and when action is truly needed. In this video, we'll talk about why thyroid nodules often appear in Hashimoto's, whether they increase your cancer risk, how we assess them, and what your next steps should be. If you've ever wondered whether Hashimoto's increases your thyroid cancer risk, the answer isn't simple. But by the end of this video, you'll have a clear, science-backed understanding. Hashimoto's thyroiditis is an autoimmune condition. That means your immune system mistakenly attacks your thyroid gland, leading to long-term inflammation. Over time, this process damages the thyroid tissue. As the gland tries to repair itself, it may develop irregular areas called nodules. Some of these are true nodules, meaning actual growths of tissue. Others are what we call pseudonodules, which are simply inflamed areas that appear like nodules on an ultrasound, but aren't actual lumps. In fact, studies show that up to 70% of people with Hashimoto's may develop nodules. And this is where ultrasound interpretation becomes so important. Now, thyroid nodules are very common, even in people without Hashimoto's. But when Hashimoto's is present, the thyroid often looks patchy or irregular on the scan. Doctors may describe it as heterogeneous or hypoechoic, which means it appears darker than normal. Some nodules are poorly defined and blend into the background inflammation. These changes can be confusing to see, but they're not always cause for concern. In fact, most nodules found in Hashimoto's are benign. Still, certain nodules do require a closer look, especially if they grow or show worrisome features. So, does Hashimoto's increase your risk of thyroid cancer? The short answer is yes, but only slightly. Studies show that people with Hashimoto's are somewhat more likely to develop papillary thyroid cancer, the most common and treatable type. To put this into perspective, imagine this. Out of 100 people without Hashimoto's, 2 may develop thyroid cancer. In Hashimoto's, it may be 3 or 4. So while the risk is real, it's not dramatic. This slight increase is likely due to long-term inflammation, which can sometimes trigger changes in the DNA of thyroid cells. Now, doctors don't biopsy every nodule. We look for red flags like fast growth, irregular shape, microcalcifications, or suspicious biopsy findings. So how do we evaluate thyroid nodules properly? It starts with a thyroid ultrasound. This scan is safe, painless, and provides a detailed look at the size, shape, and texture of the thyroid. We look at whether the nodule is solid or cystic, how bright or dark it appears, the shape and border definition, and whether there are tiny calcium deposits. To guide decisions, we use systems like TI-RADS, which gives a point score based on features, and EU-TIRADS, which categorizes nodules from 1 to 5. Based on this, we decide if a biopsy, called fine needle aspiration, is needed. Here are the general thresholds we use. Low-risk nodules are typically biopsied if they're 2.5 centimeters or larger. Intermediate risk nodules are biopsied at 1.5 centimeters or more. High-risk nodules are usually biopsied at just 1 centimeter. These criteria apply to everyone, whether or not you have Hashimoto's. We decide based on how the nodule appears, not just the background inflammation. Before we move on to the next section, Subscribe to RRJ Health to show your support. If content like this helps you feel more confident in your thyroid care, subscribing helps us bring more videos just like it. Now let's talk about what happens after the biopsy. The sample is sent to the lab and examined under a microscope. But in Hashimoto's, immune cells often flood the thyroid, making the results harder to interpret. You may hear your doctor say the result is indeterminate. That could mean Bethesda category 3, which is unclear, or category 4, which is mildly suspicious. If this happens, your doctor may recommend repeating the biopsy or sending it for molecular testing. Molecular testing checks for mutations in genes like BRAF, which help predict the risk of cancer. And while blood tests like TSH and thyroid antibodies help confirm Hashimoto's, they do not tell us whether a nodule is cancerous. Ultrasound and biopsy are still the main tools for making that decision. So, what happens next? If your biopsy shows a benign result, we usually recommend repeating the ultrasound in 6 to 24 months, depending on the nodule's features. If the result is indeterminate, we may repeat the biopsy or consider molecular testing. If it's suspicious or confirmed to be cancer, you'll meet with an endocrinologist to discuss treatment options. Even if you have multiple nodules, we usually focus on the dominant nodule, the one that's either the largest or most concerning. Here's a quick checklist to help guide your care. Ask your doctor if your nodule needs a biopsy, based on its appearance and size. Track your TSH levels, antibody levels, and ultrasound measurements over time. Understand your biopsy results. Ask what the Bethesda category means. Plan your next steps. Don't skip follow-up scans. And if needed, talk to others going through thyroid evaluation. It can help you feel more prepared. Hashimoto's and thyroid nodules can seem complicated, but with proper evaluation and follow-up, they are very manageable. My role as your doctor is to help you make sense of your test results and guide you through your options with clarity and care. Understanding your thyroid health isn't just about worry, it's about action. The more informed you are, the more confidently you can advocate for the best care. If this helped you, subscribe to RRJ Health for more clear, science-backed thyroid education. Let's take control of your thyroid journey together.